And they are here with us, the two remaining members of our Moms Club, Amy Rubenstein and Julie Griglio, along with child psychologist and early show contributor Dr. Jennifer Hartstein. Good morning, ladies.
Good morning.
So the other two have given birth. It's just the three of us. Yes. I'm June 26th. You're June 21st?
Yep.
June
26th.
26th. So
yeah.
we're right there, Jen. What should we be doing in these last couple of weeks to prepare the siblings back at home?
Well, I'm sure you already started to this, but preparing really for the big change that's going to happen when you bring the baby home. Your time is going to be very different. The baby, they want the baby to come home and play with their trains and play. They're going to cry, they're going to sleep, they're going to eat. That's really what babies do. So it's preparing your kids also for that. They aren't the new doll in the house.
Exactly.
So how to prepare for all the changes. You're going to be more tired. Significant others are going to be more tired.
You got to talk about this ahead of time.
Talk about it. You probably are doing it already, but I think in the next few weeks, that's what you really need to focus on as well.
Amy, Max is 3.
Right.
What concerns you the most?
I think him being jealous of the baby is my biggest fear.
Me too.
And I think that that's a very appropriate concern. So what you have to make sure is to carve out special time for your older child, even though you're going to be exhausted. 10 minutes of uninterrupted time where you follow their lead to play with trains as he was interested in, or read a book together. That's so important to really find that special and make them feel like they have that. Going to the grocery store with just your older child seems like a silly, monotonous task, but can be terrific because they get all of you. And that's important.
I've heard a couple of people say that the older child is going to need even more attention than the baby, right?
Absolutely.
Because the baby won't know what he's missing, or she.
Right, and there could be some regression. So be prepared. If your child is toilet trained, they might all of a sudden start having some accidents, or if they were sucking their thumb or used a pacifier and now they don't, they might start to do that again because the baby does get a lot of attention. So change is hard, and what do we do when we get stressed out? We go back to other habits and old habits, so they might do that. So don't get angry, just let them know that it's okay and it'll go back to normal. Once things stabilize, things go back to normal.
Yeah, my daughter is almost 5 and she started with the baby talk again. Sometimes she'll pretend she's a baby. She'll go, goo goo gaga, mommy, I'm a baby. Now James is 2.
Are
you concerned that terrible 2s? Are you concerned?
He's there. And he's not there too bad, but he's there. At this point, my biggest concern is not knowing exactly how much he understands. Like I said before, he'll point to my belly and say, oh, baby, but then he'll point to his belly and say, baby. So one minute you think he gets it, and another minute you're not sure that he gets it. So that's a concern of mine, is he just doesn't really understand, that he won't understand what's really happening.
So what do you suggest?
And he may not, and he does. It's a fine line, and I think what you will probably see with younger kids is more acting out behaviorally. And I think it's important to then let them have their feelings. It's going to be easy to get frustrated when you're super tired, excuse me, about what your kids are doing if they're like having a temper tantrum. But I think you have to be able to encourage them to use words and talk about how they're feeling, because their feelings are really valid. They don't get it all the time. They just know that you aren't all theirs, and that's a real struggle.
You know what I wonder about, Jen? I don't know exactly how much to allow my daughter to touch or interact with her little brother. Because, well-meaning, but they can be a little aggressive.
They can be a little aggressive, especially younger kids. Your daughter's a little older, so it's a little different. But I think practice early. Get a baby doll that you can sit with them. Get a real-looking baby doll, and it can be the gift from the baby, even, in prepping. And so practice that. How do you hold the baby? How do you hold the head? What do we do? You don't hit the baby. You don't throw things at the baby. What are the rules? Set the rules of what the behavior expectation is early, and you have a month almost to really practice that with them so that they know what to do.
All right. Thank you so much, Jen.
Good luck, everybody.
Amy, good luck. If I don't see you in person, I'll see you when baby comes.
Sounds good.
Can't believe we're here already.
I know.
Thank you, guys.
Thank you.
A lot happens early on The Early Show, weekday mornings on CBS.